people, politics, and power. It's great to be back on the beat after a brief hiatus due to the ongoing politicking towards the forthcoming general election in Nigeria. I am Imoni Amarere. For some weeks now, in the midst of the intense electioneering campaigns and the politics for the 2023 elections, there have been disturbing reports of an outbreak of a disease called diphtheria in some states of the country. According to health authorities, there have been at least 38 deaths resulting from about 123 confirmed cases of the disease nationwide. According to the Nigeria Center for Disease Control, NCDC, Kano State has so far recorded the largest number of 100 cases with 32 deaths, followed by Lagos State with 5 confirmed cases and 3 deaths. There have been 17 confirmed cases in Yobe State, resulting in 3 fatalities, while Osun State has recorded only 1 case so far. The health authorities in Nigeria do not appear to give much hope for a quick let-off, as they have cautioned that more cases are expected from more states across the country. Now, coming on the heels of the COVID-19 pandemic, which ravaged the entire world, and the creeping resurgence of Lassa fever in parts of the country, there is necessarily a cause for concern about another possible health challenge in the midst of a worsening economic environment. But what exactly is diphtheria? What are its causes? What are its symptoms, and how is it spread? How can it be prevented and or treated? What are its main risk factors, and how fatal or deadly can it be? Now, what segments of the population are likely more vulnerable to this disease? Is this the first outbreak of diphtheria in Nigeria, or has it always been here with us and we have been able to manage it much better before now? We shall also be examining the level of response to the outbreak and the surveillance being carried out by various governments and health institutions across the country. I will be joined on the program by health experts and specialists who will try to break down the issues involved for the benefit of us all. I'm going to be joined virtually via Zoom by Dr. Bola Lawal. Dr. Lawal is the lead Diphtheria Technical Working Group at the Nigerian Center for Disease Control, NCDC. And we're also going to be joined by Dr. Tunde Elijah Gaga. He is the chairman, Nigeria Medical Association, NMA. And later on, as we move on the program, we also expect to join us Dr. Abdullahi Isa. He is an epidemiologist and the Kano State Public Health Emergency Operation Center, who will be joining us virtually also from Kano. But to begin with, let's get some soundbite from Kano on what exactly has been happening in Kano State, where there have been more cases and more fatalities.
As at 30th of January, we have recorded 100 suspected cases from 13 local government areas of Ungogo, Nasarawa, Bichi, Dala, Dawakin Kudu, Fage, Gwale, Kano Municipal, Kumbotso, Rano, Dawakin Tofa, and Gwarzo. Of the 100 suspected cases, 8 were confirmed while awaiting more results. We have lost 3 among the 8 confirmed and 22 among other suspected cases. Currently, 27 patients are on admission receiving treatment, while 41 have been managed and discharged successfully. With the rising number of cases, the state government, with support of MSF, set up a diphtheria treatment center at Murtala Mohammed Specialist Hospital, and also appointed Dr. Salman Swed, consultant pediatrician, as the lead case manager, in addition to the ongoing case management by Amina Kano Teacher Hospital, led by Professor Fatima Hanga, who is also a professor of pediatrics. Cases are being managed according to protocols using diphtheria and toxin supplied by NCDC.
All right, there you have it. An analysis and breakdown of the situation as we have it in Kano. Let's now formally welcome Dr. Bola Lawa, who is the lead Diphtheria Technical Working Group, Nigeria Center for Disease Control and Prevention, the NCDC. Dr. Lawa, thank you for joining us. And let's also welcome Dr. Tunde Elijah Gaga, Chairman, Nigeria Medical Association, NMA. So, gentlemen, thank you so much for finding time to join us.
Thank you for having us on board.
Great, welcome. Now, so let's begin on an exploratory note, Dr. Bola Lawa. What is diphtheria?
Okay, thank you very much. Diphtheria is a vaccine preventable disease caused by the bacterium Corynebacteria diphtheriae. This is a disease that is actually common among children, but every individual, irrespective of the age, depending on the immune status, is actually susceptible to coming down with diphtheria. The symptoms include things like fever, cough, suggestive of respiratory tract infections, catarrh. However, in severe cases, when toxins being produced by the bacteria is actually released into the bloodstream, it will actually lead to severe symptoms that will affect the hearts, the kidneys, the nerves as well. Essentially, this is what diphtheria is, and it equally also presents with, particularly in severe cases, with swollen neck as well as sore throat. So this is basically what diphtheria is, and like I said, it is a vaccine-preventable disease, which is actually transmitted from person to person through respiratory droplets, while the individual, an infected person, is actually coughing or sneezing. Over.
Would I be correct, therefore, to say that it is a respiratory disease?
Yes, essentially it is, most cases present as a respiratory illness. However, we also have some form of skin or cutaneous infection, but this is, however, not as common as that of the respiratory tract.
Now, has it always been with us? I mean, has it always been part of the health challenge that Nigerians have faced? And if it has, why is it so prominent now?
Okay, so diphtheria is one of those priority diseases that we are actually watching out for in the country. It's a disease that actually been there for decades back. However, with the introduction of the diphtheria vaccine into our routine immunization schedule decades back, as far back as in the 80s, and we've actually recorded a significant decline in the burden of diphtheria, so much so that it has become relatively uncommon, and most clinicians have either not seen it or forgotten about what it actually looks like. However, with the waning immunity, as well as suboptimal coverage of the diphtheria vaccination against diphtheria, we've been recording pockets of cases recently, and this has actually culminated into what we are currently experiencing in the country right now. So diphtheria is something that is actually present in our environment. However, the disease is actually said to be much more prevalent in population where the vaccination coverage is actually quite low, as we currently experience it now in the country.
All right, we will come back to his treatment later on, Dr. Lawa. Of course, we'll also be looking at why it has suddenly become so noticeable as to be categorized as an outbreak at this point in time. But Dr. Gaga, as a medical practitioner, how much of this diphtheria have you or your colleagues on the field come face to face with over the years?
Thank you very much. Good afternoon, Nigerians. Just like my colleague said, diphtheria is actually a vaccine-preventable disease, and there has been a significant improvement in terms of curtailing the menace of the disease through immunization. And before now, actually, there are only sporadic cases here and there, but currently we're having, quite a number of people with the disease condition. It is not a disease that is very common, especially in Nigeria, where we have made some stride in terms of immunization coverage. But of course, once in a while, you come in contact with those that have the disease here and there. There was an outbreak sometimes back in 2011 in Maiduguri, where 8 cases were actually identified and about 21 cases that actually died from the disease. So it is relatively uncommon, but just as Dr. Bola said, with the waning immunity, it is gradually coming back, and diphtheria is now classified as one of the re-emerging infectious diseases. So it is not very common, but however, the risk is there because there are pockets of the conditions here and there. So healthcare workers need to be very, very cautious, and they need to have high index of suspicion, especially now that we have the outbreaks in about 4 states in the country, including Kano, Lagos, Yobe, and Osun State.
Yes. My next question, Dr. Gaga, is what are the main risk factors of diphtheria?
The major risk factors for the condition is, first and foremost, lack of immunization. Individuals that are actually not immunized are at an increasing risk for developing the disease. Those that have taken full dose of the immunization, at least a minimum of 3 doses, the vaccination or immunization tend to reduce the chances of symptomatic disease by up to 87%. Another risk factor is internal security, where you have internally displaced individuals that lead to overcrowding. Areas that are overcrowded also have, individuals that stay in those areas also have increased risks for contracting the disease. Of course, healthcare workers, by the nature of the disease, because they come in contact with individuals that have the disease, are also at an increased risk of contracting this disease. Very important are close contact of persons that actually have diphtheria. They are also at an increased risk of contracting the disease. So these basically are some of the risk factors that actually increases the risk of one contracting the disease condition.
You have said that diphtheria is a vaccine treatable disease. Now, how much of the vaccines are available? How available are these vaccines in the various health institutions and health centers across the country?
The vaccines are actually there. The National Primary Healthcare Development Agency have done a good job by providing the vaccine in virtually all the primary healthcare facilities in the country. And there are 3 doses given to children, usually by the time a child is 6 weeks old, at 10 weeks, and then, of course, at 14 weeks. It is expected that once a child takes the 3 doses, that would significantly reduce the risks of symptomatic disease. The problem has to do with actually awareness on the part of Nigerians and parents. There are areas where people still have doubts about immunization, and there are individuals that do not actually immunize their children, and that specifically increases the risks of those children of coming down with this particular disease condition. So I think the problem essentially is that of lack of awareness and the attitude of people towards immunization. At the national level, as I've said earlier on, 3 doses of the vaccine are usually given to children, and that has been found to significantly reduce the risk of contracting the disease. The other point I want to make is ideally there should be booster doses, because it has been shown scientifically that the immunity tends to go down with time. There's the need for even adolescents and indeed adults, especially healthcare workers, to take booster doses in order to further improve their immunity.
Yes, Dr. Gaga, as the NMA chairman on infectious disease, I'd like to ask this question. Are adults susceptible to this disease? Because you have just said that the vaccines are available and they are given to children. Now, for those who were not vaccinated at childhood, they grow into becoming adults, are they still susceptible to diphtheria?
Absolutely, yes. Individuals that are not immunized are susceptible. Adults can actually contract the disease. And the older you are, the more likely for you to have severe disease, because generally at old age, one's natural immunity is low, but any individual can get the disease, and lack of immunization automatic disease.
All right, let me turn to you, Dr. Lawa. At the NCDC, you have all the information at your fingertips, data across the country. I'd like to know how many of these cases of diphtheria are recorded on a year-to-year basis in Nigeria. Because my little findings indicate that in all, there are certainly less than 10,000 such cases every year. Is this correct? And how have these been handled over the years? Dr. Lawa, can you hear us?
Sorry, I lost you for a while. Can you please repeat the question?
Yes, I asked. I said at the NCDC, you have data, available data on diseases and their prevention, control, and treatment of various diseases across the country. As for diphtheria, how many of such cases do we record as a country every year? Because my little research indicates that less than 10,000 on a yearly basis. Is this correct? Or is it that they are not properly reported?
Okay, so thank you very much for that question. So like I mentioned earlier on, diphtheria is a disease that due to the effectiveness of vaccination program over time, it has actually become quite uncommon until recently. So over time, individuals and actually clinicians have actually more or less forgotten in quote about diphtheria, and the reporting of diphtheria has actually been quite suboptimal. The surveillance for diphtheria is actually not as it's expected. As my colleague rightly mentioned, the index of suspicion has significantly dropped. You will agree with me that a lot of clinicians, some have never even seen a case of diphtheria in the course of their training or practice, not until recently. So it's actually not that the disease is not with us. Of course, like we've said, there have been pockets of outbreaks here and there. We've had outbreak in Borno, in Katsina, in Benue, in Enugu, and some studies have actually shown that some cases are actually being recorded sporadically across the country. However, due to the poor index of suspicion, the poor awareness, and actually the poor surveillance of diphtheria, it has actually not been picked by our surveillance system and recorded accordingly. So what we actually, it is not surprising that going back to the records, we don't see much cases of diphtheria because the surveillance for it has actually not been there. But that does not necessarily mean that the disease is actually not necessarily with us. But as you can see now, it's more or less coming out clearly, and like we've mentioned, is a function of waning immunity and the suboptimal coverage of the diphtheria vaccine. So as it is, this is would be the first time NCDC will actually be responding on a large scale to outbreak of diphtheria, and this is largely due to the fact that we've actually not been seeing these cases reported. Most of the information we gather is actually reliant on what is being picked up from the health facility right to from the community right to the health facility to the LGA state, eventually being forwarded to the national level. So if it is actually not picked at this point, it will be difficult for it to be reported to the national and for us to actually have a records of it. So that is essentially the situation. But as it is now, we have surveillance that has actually been improved. Lab capacity has been built. Awareness is actually ongoing, and we have these cases being picked. Like you rightly mentioned, as at the last time we received official reports from the state, 100 cases we have actually been reported from Kano, Yobe, at least 17, Lagos, 5 suspected, while Oshuma, 1 confirmed. And we are still keeping in touch with the state so as to get more updates as the states individually and collectively respond to this outbreak.
Now, 100 cases in Kano and as it were about 32 deaths or 38 deaths or thereabout. Now, that is alarming. That's high, on the high side. How fatal, how deadly is this disease? What should people be very afraid that once it breaks out in a locality, it could really become deadly? Because that's about over 30% of or 1/3 of the number of persons who contracted the disease in Kano dying.
Yes, actually, literature has it that about 1 in every 10 individual infected with diphtheria end up dying, and that is actually now.
Dr. Bola, we cannot hear you anymore. We hope that you are able to rejoin us very quickly because we need to get those facts going.